Hello. On behalf of Michigan State College of Human Medicine, this video was made to teach you how to remove stitches at home. Different parts of the body require suture removal at varying times. See your doctor's wound instructions for the best time to remove your sutures. If you remove your stitches too early, your wound may reopen and you could cause an infection. Sutures left in place too long can make scarring worse. Sutures can stay in for as little as 5 days, while others may stay in for 2 weeks. Common times for suture removal are shown below. But ask your doctor or nurse if you are not sure when to remove stitches.
Do not remove your own sutures if you're not comfortable, the wound is difficult to reach, such as the back or hip, there is any sign of an infection, the wound does not appear to be healing, there are open areas that look like the skin has not fused back together. You cannot find your suture removal kit. Kits are available in most drugstores or pharmacies. Your sterile suture removal kit should include the following: tweezers, scissors, gauze, an adhesive bandage, and you may also want to have some antibiotic ointment on hand. First, wash your hands well and apply gloves if you have them. Then, clean the area with soapy warm water to remove any dried blood and soften the tissue around the wound. If you have any scabbing or crusting around the knots, place a warm wet washcloth on it for a couple of minutes to loosen the scab and wipe it away. Using the tweezers, pull gently up on each knot. Slip the scissors into the loop and snip the stitch. Be sure not to pull or overstretch the skin. After cutting, gently pull the thread with the tweezers to remove it. Remove every other suture along the incision line and observe for any gaping of the wound. If gaping occurs, do not remove any of the remaining sutures. Approximate edges, apply butterfly strips, and return to your doctor's office or the emergency department. A gaping wound looks like this. If no gaping occurs, continue removal until all sutures have been removed. You may feel slight pressure during this, but removing stitches is rarely painful. Don't continue to remove stitches if a wound reopens and starts bleeding. Once all the stitches are removed, clean the wound area again with soapy warm water. Cover the area with adhesive bandages or gauze. If you have antibiotic ointment on hand, apply it to the area. Try not to get the area wet for a few more days.
Return promptly or contact your doctor if any of the following occur. If there is increasing pain in the wound or a fever of over 100.5 degrees Fahrenheit, if there is redness, swelling, or pus coming from the wound, if there are red streaks coming from the wound, if there is a bad smell coming from your wound, if the sutures come apart or fall out, if the wound edges reopen, or if there is excessive bleeding. If you have any questions or problems as your wound heals, contact your doctor. Thank you for watching our presentation.